Hello students, welcome to today's class. I am Bernisha, lecturer from Emmanuel College of Pharmacy. Today we are going to discuss about an important topic from pharmacotherapeutics, that is hyperthyroidism. We know that the enlargement of thyroid glands present in the neck region is due to the hyperthyroidism. So in this video, we are going to learn about what is hyperthyroidism, its etiology, pathogenesis, along with the clinical manifestations in various areas, and the pharmacological treatment for hyperthyroidism. So here, first let's see what is hyperthyroidism. So hyperthyroidism is the hyperactivity of the thyroid gland with a sustained increase in the synthesis and release of the thyroid hormones. Once if there is an increase in the synthesis or release of thyroid hormones like TSH or TRH, it will react to or it will be named as hyperthyroidism. So here it is also known as thyrotoxicosis, which is a technical term for the too much thyroid hormones in the blood. So hyperthyroidism is also known to be the thyrotoxicosis. So toxicology also refers to the term which has too much of things which is present in the blood. So here the thyrotoxicosis is a technical term which shows the too much of thyroid hormone in the blood. So in this picture we can easily differentiate the normal healthy thyroid gland as well as the hyperthyroidism patients. In the normal healthy persons, thyroid glands looks very in a subtle range, but in the hyperthyroidism there is the here the enlargement of thyroid gland is seen. So here mainly there will be goiter or bulging of eyes. So in goiter there will be the enlargement in the neck regions that shows the enlargement of the thyroid gland, and next will be the bulging of eyes. So there will be the presence of edema in the retroorbital areas. So from the healthy to the hyperthyroidism patients, we can easily differentiate their conditions with their physical appearance. So next will be the etiology. So etiology, for that first we have to know about the Graves' disease. So Graves' disease is nothing but there will be the enlargement of the thyroid glands. So when there is an increasing in the thyroid stimulating immunoglobulins which they attach towards the thyroid hormones, these antibodies attach to the healthy thyroid cells and can cause the thyroid to create too much of thyroid hormones. Once there is too much of secretion of thyroid hormones, that condition is known to be the Graves' disease. So, other than that, there will be the toxic nodular goiter. If a person having the Graves' disease, he may also have the hyperthyroidism. If she or he have a toxic nodular goiter, they may also have hyperthyroidism along with thyroiditis, exogenous iodine excesses, pituitary tumors as well as thyroid cancers. These are some of the conditions which may also prone towards the hyperthyroidism conditions. So here first, Graves' disease. So Graves' disease is an autoimmune disease which mainly affects our immunity with or without known with unknown etiology. The etiology of Graves' disease is unknown, but it is marked by the diffused of increased secretions of thyroid glands or enlargement of thyroid gland. It will be of an enlargement of thyroid gland or else the excessive thyroid hormone secretions. Here it is also have some other factors such as infections or stressful life events may interact with the genetic factors to causes the Graves' disease. Graves' disease accounts for more than 75% of the cases of hyperthyroidism. If a person or individual is suffering from hyperthyroidism, mostly 75% of the people may affected by this Graves' disease. Usually, the patients will develop TSH antibodies or TSH receptors to develops the antibodies to the TSH receptors. Next, these antibodies will attach towards the receptors and stimulates the thyroid gland to release the T3, T4 or both the hormones. So we know that thyroxine hormones or parathyroxine hormones are the hormones which are secreted by the thyroid glands. Once the antibodies produced by the immunoglobulins, which is attached towards the TSH receptors, these receptors will stimulate the thyroid gland to release the T3 and T4 hormones, or both the hormones. Once there is an excessive release of these thyroid hormones, which may really leads to the clinical manifestation, which is associated with the thyrotoxicosis. So the disease, which is characterized by the remissions and exacerbations with or without the treatment. So there is an progress to destruction of thyroid tissues, causing the hypothyroidism. There is two similar conditions in thyroid. One is hyperthyroidism and another one will be the hypothyroidism. If there is an excessive secretion of thyroid hormone, it will be known to be hyperthyroidism. And if there is an decrease in the secretions of thyroid hormones, it will be known to be the hypothyroidism. So next will be the toxic nodular goiters. So nodular goiters are the thyroid hormone secreting nodules. Usually, it mainly functions independent of TSH stimulations. If these nodules are associated with the hyperthyroidism, they are termed as toxic. So, usually the nodules will secrete the thyroxine hormones, but if it produces or secretes excess of hormones or excess of TSH, it may turn to be toxic. So, the nodules are usually benign and follicular adenomas. So, it's like tumors which is present on the thyroid gland. So the clinical manifestation. So clinical manifestation is nothing but the signs and symptoms which is associated with the hyperthyroidism. So it increases the metabolism. So usually the patients will feels always fatigue. So it also increases the tissue sensitive to stimulation by the sympathetic nervous systems. They may also have tissue sensitivity. Palpitations of thyroid glands may reveal a goiter. So there will be like palpitations, and also aspirations of thyroid gland may reveal bruises as well as reflections of increased blood supply. Uh, Ophthalmopathy, a term used to describe the abnormal eye appearance or functions. So here ophthalmopathy, so ophthalmic always refers towards the eyes. So when there is an enlargement of eyeballs, or there is any edema present on the retroorbital area, it may be referred to as the ophthalmopathy conditions. So, when's a classic finding in a Graves' disease is exophthalmos. So, exophthalmos was a protrusion of the eyeballs from the orbits. So, the eyeballs from the eyeballs in the eyes will protrude outside the orbit. So, it's like somewhat the eyeballs are coming out of the eyes. So, that condition is known to be the exophthalmos. So in this picture, we can easily see the conditions of exophthalmos. So it's a types of infiltrative ophthalmopathy. So it is due to the impaired venous drainage from the orbit. So the orbits will show the impaired venous drainage, which causes the increased fat deposits and fluid in the retroorbital tissues. Once there is an increased fat deposits or fluids in the retroorbits, it may shows the protrusion of the eyeballs from the orbit. So that condition is known to be the exophthalmosis. So exophthalmos is the one of the major signs and symptoms of goiter or hyperthyroidism. So next will be the acropathy. So acropathy is another condition in which is refers to the dermopathy, which is associated with the Graves' disease. Usually it is characterized by the soft tissues, swelling of the hands and clubbing of the fingers. Usually the soft tissues present in the hands gets swelling in the hands, and it gets clubbed over the fingers. So that condition is known to be the acropathy. So these are some of the signs and symptoms which is associated with the Graves' disease. Exophthalmos as well as the acropathies are the both the signs and symptoms which is mainly associated with the Graves' disease. Next will be the cardiovascular manifestations. Usually The thyroid is also associated with the cardiovascular system. It may shows the systolic hypertension. So hypertension, we almost know that the elevated blood pressure. So if a person is suffering from or a person is having hyperthyroidism, he or she may have systolic hypertension. Next will be the increased rate and course of cardiac contraction. So, the contractions of the muscles present in the cardiac, like myocardia, so it increases the heart rate or else it increases the force of cardiac contractions. Next will be the bounding and rapid pulse. So, while we are checking the pulse, it may show us the rapid and bounding of pulse. And next will be the increased cardiac output. So, increased cardiac output, it also known to be the cardiac hypertrophy along with systolic murmurs. Next will be the dysarrhythmias. Dysarrhythmias is nothing but so next will be the palpitations. Palpitations is also a conditions which also has to be with the increased heart rate or conditions. Next will be the atrial fibrillation, which is most common in the older adult. So these are the manifestation which is associated with the cardiovascular system. Next will be the respiratory system. In respiratory system, which shows increased respiratory rate. So increased respiratory rate means nothing but Mm, the mm, the process of exchanging of gases or due to the breathing, it increases the respiratory rate. Next will be the dyspnea on mild exertion. So there will be the loss of oxygen conditions. And next will be the gastrointestinal clinical manifestation. In this, there will be the increased appetite. We also know that it increases the metabolism. So while it increases the metabolism, it automatically increases the appetite and thirst. So while though the people will suffering from hyperthyroidism has increased appetite and thirst, but they have increased metabolism, they shows severe weight loss. Next will be the increased peristaltis moment along with diarrhea, frequent defecations, and increased bowel sounds. So these are some of the gastrointestinal clinical manifestations. The clinical manifestation of respiratory system mainly includes increased respiratory rate, dyspnea, or mild exertions. Next will be the gastrointestinal system. It is increased appetite, thirst, weight loss, increased peristalsis, diarrhea, frequent defecation, increased bowel sounds. Next will be the nervous systems. It shows difficulty in focusing eyes, nervousness, fine tremor, which will be a shaking of fingers and tongue, insomnia, loss of sleeping. Next will be the liability of mood and delirium. Next will be restlessness, personality changes of irritability and agitations. Usually the persons will show more mood swings, exertions. Next, hyperreflexia on tendon reflexes. Next will be depression, fatigue, apathy. Usually this depression, fatigue, apathy is usually in the older adults. Next will be the lack of ability to concentrate. So once there is a lack of ability to concentrate, next will be the stupor and coma. These are the advanced stage or severity of the clinical manifestations of nervous systems. So these are the signs and symptoms which we can easily identify in the nervous systems. Next will be the complications. What are the complications which will be faces while we have hyperthyroidism? Usually it shows thyrotoxic crisis. So it is also called as thyroid storm. Is an acute rare condition in which all the hyperthyroid manifestations are heightened. So although it is considered a life-threatening emergency, death is rare when treatment is vigorous and initiated early. So it causes throughout the stresses. So infection, trauma, surgery in a patient with pre-existing hyperthyroidism, either diagnosed or undiagnosed. Next will be the clinical manifestations for toxic crisis, thyroid crisis. So here we can see severe tachycardia. So there will be the high heart rate. Next will be heart failure, shock, hypothermia, so that the body temperature may rises up to 105 degree, 0.3 Fahrenheit. That will be a 40 to 40.7 degrees Celsius. Next will be the restlessness, agitation. So agitation is a state of anxiety or nervous excitement. Along with there will be the prolonged seizures, abdominal pain, nausea, vomiting, diarrhea, delirium, and the severity of the stage may lead to coma. So these are the clinical manifestations which are related towards the hyperthyroidism. Next will be the treatment. For the treatment, it is aimed at reducing the circulating thyroid hormone levels by appropriate drug therapy. Usually, the supportive therapy is directed at managing respiratory distress, fever reductions, fluid replacements, eliminations, or management of the initiating stresses. So how we can diagnose these conditions? Usually we can diagnose this by history and physical examination, ECG, ophthalmologic examinations, laboratory tests which shows decreased TSH levels, elevated free thyroxine levels, radioactive iodine uptake. So the radioactive iodine uptake is a test which is used to differentiate grave disease from the other form of thyroiditis. The patients with grave disease will show a diffuse, homogeneous uptake of 35% to 95%, whereas the patient with thyroiditis will show an uptake of less than 2%. So these are the diagnoses which is used to know the thyroiditis conditions. Next will be the anti-thyroid drugs. So it is the first line drugs, mainly the pharmacological management. Usually the pharmacological management includes the use of drugs. In the first line drugs, we can usually use propylthiouracil and methimazole drugs. So these propylthiouracil and methimazole drugs inhibit the synthesis of thyroid hormones, and it also blocks the peripheral conversion of T4 to T3. So these are the first line anti-thyroid drugs, propylthiouracil and methimazole. Next will be the iodine. So iodine is used for other antithyroid drugs to prepare the patients for thyroidectomy or for the treatment of thyrotoxic recession. So thyroidectomy is nothing but removal of this thyroid glands. Next will be the administration of iodine. Large doses rapidly inhibits the synthesis of T3 and T4 and blocks the release of the hormones into circulations. It also decreases the vascularity of the thyroid gland and making the surgery safer and easier. Usually the iodine is a radioactive iodine is used in the treatment of goiter and thyroid hyperthyroidism. Next will be the beta-adrenergic blockers. So these beta-adrenergic blockers are used for the symptomatic relief of thyrotoxicosis. So this results from increased beta-adrenergic receptor stimulations, which is caused by the excess of thyroid hormones. Usually the drugs like propranolol, atenolol. So these propranolol drugs is usually administered with other antithyroid agents like propylthiouracil or methimazoles to rapidly provide the symptomatic relief. Next will be the atenolol. So atenolol which shows preferred beta-adrenergic blockers for the use in the hyperthyroid patients with asthma or heart disease. So next will be the radioactive iodine therapy. So radioactive iodine therapy is a treatment for the choice of most non-pregnant adults. Mostly the non-pregnant adults will choose the radioactive iodine therapy. It damages or destroys the thyroid tissues, thus limiting the thyroid hormone secretions. So once the radioactive has delayed responses, the maximum effect may or may not be seen within 2 to 3 months. So for this reason, the patient is usually treated with antithyroid drugs and propranolol before and during the first 3 months after the initiations of radioactive iodine therapy until the effects of radiations become the apparent. Radioactive iodine therapy is mostly used in the treatment choice for non-pregnant women. Next will be the surgical therapy. Surgical therapy is indicated for the individuals who have been unresponsive towards the antithyroid therapy. So, for individuals with very large goiters causing the tracheal compressions or for the individuals with the possible malignancy. Additionally, the surgery may be done when an individual is not a good candidate for the radioactive iodine therapy. The one of the most advantage for the thyroidectomy was it's over radioactive iodine is it's more rapid than reduction of T3 to T4 levels. Next will be the subtotal thyroidectomy. Subtotal thyroidectomy. It is preferred surgical procedure and involves the removal of significant portion of the thyroid gland. So once the significant portion of the thyroid glands gets removed, it's known to be the subtotal thyroidectomy. So these are the surgical therapy which is used in the treatment of hyperthyroidism. Next will be the endoscopic thyroidectomy. It is a minimally invasive procedure. In this procedure, for the patients with the small nodules less than 3 centimeter, where there is no evidence of malignancy. If there is a malignancy, it will be goes to thyroidectomy. If it is a non-malignant tumors, we can choose endoscopic thyroidectomy. So advantages of endoscopic thyroidectomy over the open thyroidectomy includes less scarring, less pain, and the faster return to the normal activity. So endoscopy is a normal procedure which is more safer, pain, scarring, less scarring, and it's a faster return to the normal activity than that of the thyroidectomy. So the people mostly chooses the endoscopic thyroidectomy over the thyroidectomy process. Okay, students, I hope you all have completely learned about what is hyperthyroidism. So, hyperthyroidism is nothing but the excessive secretion of the thyroid hormones. So, once there is an excessive secretions of thyroid hormones, it may also lead to Graves' disease or goiter. So, next we have learned about what are the clinical manifestation which has taken place in various systems of the body like cardiovascular system, nervous system, along with various ophthalmological systems. So here the most of the clinical manifestations for the hyperthyroidism may lead to exophthalmos conditions. And next we have learned about what will be the treatment. So here mainly we are using the first line drugs as propylthiouracil as well as methamesols along with iodine therapy, radioactive iodine therapy, and along with beta adrenergic blockers. These are the certain things we have completely learned about what is hyperthyroidism and the pharmacotherapy of hyperthyroidism. Okay, students, let's see in the next class with the next video. Thank you.